Hi there and good afternoon. Thanks again for joining us. My name's Dougal Saunders. I'm the State MP for the Dubbo electorate. I'm joined again today by the New South Wales Local Health District Chief Executive Officer Scott McLaughlin and also Assistant Commissioner Jeff McKechnie, Commander for the Western Region for the New South Wales Police Force. Also council representatives here today I firstly want to thank actually the entire team behind all of the work that's going on around the region, particularly focused on Dubbo and Mudgee and Walgett at the moment, who are doing an exceptional job in really trying circumstances. I think that's really important to say up front. Look, as far as positive cases, up until 8 o'clock last night, we have 35 new cases for the entire region. 32 of those are in Dubbo. That takes Dubbo's total now of active positive cases to 91. Mudgee has 3 cases, so that includes the 2 cases that I mentioned yesterday. There is also 1 new case for Mudgee, which is listed at Mudgee, although the person is actually a resident of Sydney. So it will be recorded as a Mudgee case. The person has not been in Mudgee during the infected period and is a resident of Sydney, but that case will be recorded as a Mudgee case because that is the address of residence. So 3 cases officially for Mudgee, and Walgett still at 4 cases. So across the health district right now, as of 8 o'clock last night, 98 active cases of COVID-19, which is obviously of concern. The 1 additional case to add, which will be in tomorrow's numbers, has just been confirmed, and Scott can talk more about this, is 1 active case at Burke, which has just been confirmed this morning. Testing numbers are still really good. 9,700 or thereabouts across the entire health district, which is a really positive sign. About 5,000 of those at the Dubbo area, including the drive-through clinic at the showground. We want that to continue, obviously, with any symptoms at all, even the mildest of symptoms, or any concerns around where you've been. We do need you to get tested as quickly as possible. That brings on the venues of concern. So that is updated very regularly. It is really an evolving scenario, so we do ask you to keep an eye on the venues of concern on the website. And again, some of those venues of concern are adjusted slightly. If you're advised to get a test, please do get a test. We're very well aware that some tests are returning more quickly than others. We would ask you to be as patient as possible. After 72 hours, there is a number to call. The health district number is 1300 066 055. Other pathology groups have their own numbers, but really only after 72 hours is it appropriate to start calling, because that is the regulation time frame, I guess, that people are expecting to have a test result back to you. The other thing to remember is that you're in a queue. That's the reality. All of our pathology clinics are being absolutely hammered at the moment, so do try and understand. We are trying, they are trying as much as possible to get your test back to you as quickly as possible. It's not always possible to get it done within 24 hours, but many are. So that's obviously something we're working on. There have been a few questions just around some of the new rules regarding essential shopping and how that affects regional areas. I think it's been clarified a lot this morning, and I've done a bit over the weekend, and the Deputy Premier's mentioned it again this morning. The case for leaving home for essential shopping and medical supplies and the like, there is no kilometre requirement, there is no requirement to stay absolutely within your local government area. If you're in a regional area and your closest shop is 5 k's across another border of council, that is fine. Do it sensibly, go to the shops, do what you need to do, register when you're there, register as in check out when you leave, and go straight home. That's fine. We don't want you driving an hour and a half out of your way to stay within a local council area. We want you to do the smart thing, the sensible thing, the common sense thing. So whether it's food for you, food for the pets, hay for the horses, you can do that in another local government area if that is the quickest way and the easiest way to do it and makes the most sense. Don't take advantage of trying to do that and go for a day trip with your family to go shopping. That is not what this is about. One person from the household should be doing the shopping, not a group trip. So that's very clear, and for regional areas that's a really important clarification to make. So I hope that makes sense to everyone. Look, just a bit of news from Fletcher's International, which is one of our biggest employers in Dubbo. Fletcher's has publicly announced this morning that they will be closing the abattoir for this week. Now, there are no positive cases, but Roger and his team have been reaching out over recent days just to talk about the best ways to prepare their entire team for the future. Meat workers and abattoirs are an essential service, so they're doing absolutely everything within their power to make sure that everything is in exactly the way it needs to be going forward. So this week will be a week to re-establish all of their procedures and processes and make sure that they are keeping all of their workforce as safe as possible. So I think that's a really positive move. And look, learning from home continues. I'll run through some of the schools in just a tick, but I mentioned on Friday 98% of students have been learning from home and only 18% of staff have been at schools. Learning from home still happens whether you're at school or at home, so it's no different program or curriculum. It is the learning from home curriculum that's being supervised at schools, and those schools do remain open where they can to provide for some of our essential workers, our ambulance drivers, our nurses, doctors, our police force. So that's really important. A couple of things to mention. One is the Dubbo District's Athletics Carnival, which we did put some information out about last night. Many students and also many school staff were involved attending that carnival here in Dubbo on Friday, August the 6th. A positive case confirmed there. Both close and casual contacts have been identified, and all families involved in that are being contacted by their schools if they haven't been already, so that's under control. The Arana Heights Public School and the Dubbo College South Campus are both remaining non-operational through until August 26. In that case, additional confirmed cases for both schools, and all staff and students are being asked to test and to isolate regardless for 14 days for both of those schools. Dubbo West non-operational today and again tomorrow. Dubbo South Public and Dubbo Delroy College Campus both non-operational today, planning to be open tomorrow. Buninyong and Dubbo School of Distance Ed both non-operational at this point as well. Mudgee High School, member of the school community there, has tested positive, so it is non-operational as of today, and we'll have more information about that. Contact tracing and cleaning obviously going on there. And Macquarie Anglican Grammar School, MAG's, due to open again today, again for students that are unable to learn from home. So that's basically where things are up to at the moment. I'll ask Scott to update things from a health perspective now.
Burke and Mudgee. We've seen in the last 24 hours to 8 p.m. last night 35 new cases identified in those locations. Overnight we've seen one new case identified in Burke. Now that's a gentleman who's in our local hospital or multi-purpose service. I'll provide further updates down the track on that. We're still seeing the majority of infections and COVID confirmed cases that are infectious in the community. That's a really concerning part. We know people are moving around the community more than the stay-at-home orders and more than they really need to. The vast majority of cases are Aboriginal, and we've got nearly 40% of the cases are kids between the ages of 10 and 19. So this is a really serious warning for parents and kids running around everywhere at the moment. Please stay at home. We know that COVID is spreading both in schools to some degree, but in a larger degree in the community, and so please, this is the time to protect our most precious kids in our communities. We've got hundreds of people in isolation, both in their homes. We've now established some accommodation services in Dubbo that's providing a critical solution to both confirmed cases and to people needing isolation, either because they're a close contact or needing some accommodation. We have 2 patients in hospital. The patient that I outlined yesterday was discharged yesterday, so we have a new admission into Dubbo, and obviously the patient that I outlined earlier in Burke. Now, pleasingly, we saw over 9,500 tests done across the whole of the region yesterday, so can I say a huge thank you to everyone right across the region, from Bathurst up to Burke, Cobar up to Carnival. Please, thank you for the commitment to coming and getting tested. Now's our time to step it up even further. We've seen over 4,500 tests done in Dubbo yesterday, and so to the Dubbo community, thank you again. That's nearly 20,000 tests in the last week that have been done in Dubbo, or nearly half of the population, so thank you. It is time though, for people that have been tested previously, if you have any symptoms or any other concerns, please come and get it back and get tested. Just because you've been tested once doesn't mean that you're free forever of COVID, and so this is something that needs to be continually monitored. We've now got 57 venues of concern across Western New South Wales. Overnight, a couple of venues of concern identified in Orange and Bathurst, so I can urge the community to please check the New South Wales Health or New South Wales Gov websites. Those details are available. If you have been in any of those venues, please isolate, come and get tested until you get the results of those. If you are a close contact, our public health teams will be in contact. 49 venues of concern in Dubbo. That number will continue to grow. We're still seeing the venues of concern identified from late last week when people were out and about more than they are at the moment, and 4 venues of concern in Mudgee. Our sewage testing, and no surprises here, has identified further COVID fragments in the sewage in both Parkes and Burke. We know last week we had sewage detections in Bathurst as well, and so can I please urge those communities come out and get tested as an absolute priority. We've got to get in front of this. These sewage detections are one of the very early warning signs that we've got. So just to come back to testing numbers, as I said, Dubbo almost 4,500, Mudgee 832 in the last 24 hours, Bathurst 171, that's much lower than we'd like it to see. Orange 324, thank you to everyone from Orange. Parkes 191 and Burke 162. Now with the new cases and sewage detections in those communities I've just outlined, please, to those communities, come and get tested. Any symptoms, however mild, or any concerns that you have, come and get tested in the next 24 hours. So the opportunities for that, Dubbo, we've got the showground that'll continue to be open from 8 a.m. till close, which recently has been later and later in the day to make sure that everyone can get tested. The COVID Safe Clinic at the Monera Plaza, that's a walk-in clinic, 8 a.m. to 4:30 p.m. The testing site over in West Dubbo at Pioneer Park, 9 a.m. to 4 p.m. and the respiratory clinic here in Dubbo at the Dubbo Medical and Allied Health Service. In Walgett, the drive-through clinic will move today to Alex Trevelyan Park, 9 a.m. to 4 p.m, and we'll be maintaining that through the week. Burke, this morning up until 1:30 p.m, the community health building is available for testing. We'll have a drive-through testing service available from 1:30 this afternoon right through until 5 p.m. Parkes again at the showground, 10 a.m. to 3 p.m. today. Mudgee at the AREC, 8 a.m. now, open earlier to 3 p.m. Today. Bathurst at Mount Panorama, which is open 8 a.m. to 4 p.m. and will continue to be available. And Orange at both the showground and Wade Park in the town. At all of our other health services, we've got testing available at the local hospital or multi-purpose service in most towns. Please ring ahead if you need a test. We'll be able to book you in and make that as quick and easy as possible for you. Now, as Dougal outlined, our call centre is available if people are concerned that they haven't got a test back in 3 days or more. 1800 066 055. We are trying to get information through to the pathology providers to fast track those. With the increased numbers of tests right across the whole of the state, our pathology services are under pressure. We have seen those significant decreases in times for the New South Wales pathology tests. I want to tip my hat to the team here at Dubbo and our other large hospitals that yesterday turned around nearly 2,000 tests in vast majority of those under 24 hours. So thank you to the teams that are helping that to happen as quickly as possible. To vaccination, we've this morning taken delivery of 2 more trays of Pfizer into the region. That's now a total of 7 trays of Pfizer in the last week. Those 2 trays of Pfizer that went up to Walgett last week, we've seen nearly 1,000 people with vaccination in their arms over the last 4 days. And so thank you to everyone in Walgett that's coming to getting vaccinated. This is the critical time, and so please come forward today. There's still appointments available and time to get vaccinated. We will be scaling back up our vaccination hubs across Dubbo, Orange and Mudgee from today with that extra supply of Pfizer that's come in. We're looking to stand up further vaccination locations in Dubbo throughout the rest of the week, and so I'll come back and update further on vaccination opportunities. There is a lot of vaccination opportunities in every community right across the region through the local GPs, the pharmacists, the Aboriginal medical services and the respiratory clinics. Please, there's a lot of Pfizer and a lot of AstraZeneca available. There are additional supplies coming in from the Commonwealth. Until late last night we had long discussions about the Commonwealth's additional Pfizer supply that's coming in. Last week they supplied over 7,500 new doses up to the Burke, Brewarrina, Walgett, Lightning Ridge communities, and so that'll be a fast track for all of those communities to get vaccinated through particularly the GPs and Aboriginal medical services. And there's more on offer, and so I'll update further in the week on additional supplies coming into the whole of the network. As I mentioned earlier, we've now established a accommodation service in Dubbo, and we will be looking to roll that out further. We know that people in their homes trying to isolate sometimes find it difficult to isolate from their family or friends and other household members, and so that service is being stood up. We'll continue to expand that over the coming week. We know there'll be a further need for that. Along with that, we've got a lot of services and support going into people's homes where they're isolating. I think yesterday we did hundreds of deliveries of food packs, of medication, of gas bottles, of everything that people are needing in those homes. So I really want to say thank you to the whole team of our Aboriginal health clinicians that are staying in touch with those families and communities to provide that necessary support in I know what is a very stressful and concerning time. Also for people that get sick with COVID. And we've taken some steps this morning to start to scale back our elective surgery across all of our hospitals from tomorrow. So that'll be hospitals that'll be impacting from Orange, Bathurst, Cowra, Parkes, Forbes and Mudgee. We already started to pause elective surgery from today at Dubbo. Now, to those people that were booked for elective surgery, I'm terribly sorry. This isn't a step that we've wanted to make. We know that your surgery is important and we will prioritise you down the track. It's a step that unfortunately we need both the hospital capacity and the workforce to help us to respond to this rapidly evolving situation. We will be also looking at some of our specialist outpatient clinics and other community-based services. What's coming in the next couple of weeks we know is going to be incredibly challenging for us. We want to make sure that everyone can get tested, that everyone can get vaccinated, that we can get people to the right care at the right place and the right time in all of our services, and so please ask for some understanding and consideration of that. Now with that, what I would like to say is we are going to see this situation continue to grow. It is incredibly scary and concerning for all of us, I know, in Western New South Wales. The things that we can do is stay away from other people, stay at home, stop your contact, stop this virus spreading around our short period of time. Let's stop COVID dead in Western New South Wales. Please take care of each other, show some care and compassion to your friends, family and all of our community. Thank you.
Good afternoon everyone, Jeff McKechnie from New South Wales Police. I'll talk firstly from an emergency management perspective of what's going on right across Western region. As the Region Emergency Operations Controller, I sit across all the local emergency management committee meetings, committees that are meeting across the region every day at the moment. Those committees are working hard at the moment with all of our partner agencies and our communities to deliver the services Scott was talking about in terms of vaccinations and testing. Where we don't have any active cases, those committees are focused on supporting health in delivering those services, and that's going to be a massive job over the next weeks, months, as all of that vaccine rolls out across Western region. So we too would urge people, when they see the opportunity in their towns, to come forward and be vaccinated. In the meantime, come forward and be tested. It's so important. We have established a welfare subcommittee of the Region Committee, and that is looking at delivering assistance to families and individuals impacted by the lockdown. And we are already distributing a lot of welfare, a lot of food support, a lot of logistical support right across the Western region through those processes, and that will continue. From a policing perspective, Operation Stay at Home, our statewide operation, commenced at midnight last night. That operation has seen us focus every available operational police officer that we have on compliance around the health orders. Overnight here in Dubbo, we issued just over 20 infringement notices to people who still haven't got the message about staying at home. Across the region, a minimum of 75 tickets were issued to people who, again, can't comply with what really is the simplest of orders. Stay at home, protect yourselves, protect your families. We still see people moving from house to house in some of our highly populated areas, children out and about when clearly they shouldn't be. And when we think that 40% of the people who are currently ill with COVID in Dubbo are children, I mean, that's a big problem. Parents need to know where their children are. Their children need to be in their houses with them, safe, being protected from this virus. We can't stress strongly enough the need for the community to work with us on this problem. We can be out there enforcing the legislation, handing out tickets hand over fist. But at the end of it all, it's about the community, about individuals, about us as people here in Western New South Wales taking some responsibility for our own actions, keeping ourselves and our families safe. The health orders really are, in my view, a minimum requirement. Staying at home, only going out for shopping, only going out for work, only going out for those essential reasons are the absolute minimum we need to be doing. On top of that, we need to be treating every person we come in contact with in these areas at the moment as though they may have COVID. Because they may well have COVID. There's 35 new people overnight with COVID. So you may have COVID yourself, but you don't have any symptoms. It takes a couple of days. The people you're talking to, the people you're socialising with may have COVID. You have to treat everybody in that way. And if you do that, maintain the social distancing, maintain the hygiene, and apply the health orders by staying at home, hopefully at the end of this, you'll still be with us. All your family members will still be with us. Your children will still be healthy. It's so important. We are out there, as I say, 24/7. Every available traffic and highway patrol car is on the road. I've instructed the commanders in Western Region at the moment to stop any vehicle leaving Dubbo, making their way north, south, east or west where possible. Check the bona fides of the people in those vehicles and make sure that their travel is essential. If it's not, we only issued one warning across the region last night, and the time for warnings is gone. You will receive the minimum $3,000 ticket if you aren't heeding the current health orders. I can't make it any clearer than that. Thank you.
I'll just add quickly, and look, Scott, myself and Jeff all available for questions as well. One of the other questions that has come up is people concerned about sometimes not finding out about venues of concern until later in the night or the next day. Part of the point of the stay-at-home order is to protect you in the meantime. So if everyone is doing the right thing around staying where you are and not doing things that aren't essential, the risk of you being impacted or affected are far lessened as well. So if you could just bear that in mind. Are there any questions?
It's really strong words from all of you today. Given that the trend is that we're going to see more cases, more venues of concern, what's the likelihood that we'll actually be out of lockdown anytime soon?
Look, the whole of the state is at stay-at-home orders until next Saturday. I would suggest that it would be incredibly optimistic to think that Dubbo and the region would.
And Gladys and the Premier and Kerry Champ both said today that Dubbo and the communities in Western New South Wales are of a real concern at the moment. Do we have enough resources both in Dubbo and out there in terms of staff, vaccines, clinics, testing clinics, vaccination clinics? Is there enough?
Yeah, look, I might get Scott to talk to that as well, but I can tell you that there is a whole of government approach, and that involves police, health, government officials, and looking for more possibility of assistance as well. So as far as the actual boots on the ground, that is increasing all the time. The clinics have ramped up dramatically. As you've heard Scott talk about, the vaccination availability is there, the testing is there. That's attempted to be ramped up all the time as well, and more possibility of doing more hopefully by within the next few days of this week. So we definitely have more plans in place, and there are definite needs to have more boots on the ground and as many people helping out as much as possible. Part of the difficulty is just coping with the actual volume of people, particularly in our larger centres like Dubbo that want testing, and turning that around. And that in some cases is a manpower thing. So efforts are certainly being put into helping rectify that.
On that, just is there any indication of what sort of resources? Like, are we talking increased staffing for setting out field hospitals, or sending out ADF resources, or getting more police?
Look, there's a bit of everything, and look, I haven't been involved in discussions with the ADF, but there certainly have been, and there's been lots of different components can be brought together in the best possible way, and that's something that certainly will be evolving over coming days. Grab Scott.
Thanks, Dougal. I can just cover off a little bit on the extra resources that are coming into the region. One of the commanding officers from the ADF is here in Dubbo this morning, speaking with our commander here at Dubbo about how an initial deployment of ADF personnel commencing tomorrow will work with police in the town and in towns further west of here. We expect ADF resources to increase over the coming days. It's being managed through our region emergency management processes, and any agency that requires assistance can ask for that increased presence of ADF staff to help out. We are also tapping into our other emergency services partners, SES, RFS, VRA, around supporting particularly testing sites and vaccination sites. So there are extra resources coming. I understand there's a very significant resource around the vaccination program that will roll out in the coming weeks as well. It's not just about people giving needles, obviously. There's a lot of support staff go in around that, and those folk are coming to the region and will be deployed right across the west in coming weeks. In terms of police, extra traffic and highway patrol police are in the region and on the perimeters of the region at the moment. We don't have any extras obviously coming out of the metro area in terms of general duties police, but we don't need them. We are deploying our staff in a very effective manner. Thankfully, we haven't been impacted by COVID on our workforce at this point. We're taking every precaution in that regard, and we will continue to serve every community. If there's an issue, please let us know, and particularly if you need help in some way, please stick up your hand. Don't leave it till it's too late to ask for help. Thank you.
Happy to pick up on that additional resourcing. From a vaccination perspective, the Commonwealth has committed to send some ADF personnel in, I think 5 teams coming in over the next week to 10 days, some of those arriving as early as Wednesday this week to help us start vaccinating, particularly across the Walgett, Bourke, Brewarrina and northern part of the region. In terms of other workforce for our services, we are stretched, but there's no question. Our workforce is finite. We'll continue to try to free up a workforce to help to support people in the homes, in accommodation, and particularly patients that might need care in our hospitals, and particularly dedicated to the testing of people coming through all of our communities. So We're reaching out to a lot of the other providers of health services and other support services in the community, that they're all putting up their hands and willing and able to help. There is additional offers on the table from the Commonwealth that we're in discussions around what the next evolution of that support looks like, and particularly the supports, as Jeff has just outlined, to work closely with police and help people to be in the right places, but also to receive the right support in their homes if they need to.
Can you tell us how many, obviously the numbers of children who contracted the virus are really high, and that's a major issue. Can you tell us how many children who are eligible, Indigenous children aged 12 to 15, how many of them have actually been vaccinated at this point?
I'd say very few have been vaccinated, given that ability for 12-year-old plus has just been opened up in the last week, and so that's a very new change. We are very keen to see kids in the 10 to 20-year-old group get vaccinated, so particularly Aboriginal kids above 12 years old in Dubbo and the surrounds. Vaccines of Pfizer is available. Please reach out to your local Aboriginal medical service, GPs, respiratory clinic, and our vaccination hubs if you're keen to get a vaccine.
Is there any plans for like one of those larger scale drive-through type vaccine super centres that we're seeing in like Armidale and Sydney, for instance?
Yeah, so we're planning to stand up a drive-through vaccination hub here in Dubbo in the next week. The finer details of that are still being worked out. With the additional supply of Pfizer coming in and the good supply of AstraZeneca, we believe that's going to be possible. We're also looking at a vaccination centre in West Dubbo at some stage in the next week to 2 weeks. Now, those are steps that we're taking as quickly as possible to get extra vaccination services available. But what we do know is there's a lot of vaccine going into arms at the moment through GPs, the pharmacies, respiratory clinics, and other vaccination centres. So please look to the Health Direct website or call Health Direct. They've got a fantastic resource that can help you step through what vaccination is right for you, where it's available, and how to book in.
You mentioned that LHD is feeling stretched. We've had reports that the Mudgee hospital, the Mudgee as a town is running out of testing swabs, and the hospital stocks are being sort of pulled upon to get some tests done there. Is that true, and how are resources for testing kits, for example, across the region looking?
We've got a good supply of PPE, of testing kits, and all of the other resources for staff right across the region, and more coming in big volumes at the moment, and so the support for that's been really valuable. Where it does get stretched is where we've got a really quick run on things, and particularly yesterday with a big number of people coming to get tested in Mudgee, that was a bit of a scramble to get together all of the equipment and support services, but no, we're fine with PPE, with testing, swab kits, and all of the other gear at the moment.
Should, well, I shouldn't say should, but as you know, the cases and venues continue to rise, what's the next step? Is there another escalation in terms of health and emergency response that could potentially happen? And what would be the threshold, I guess, for that to be enacted?
We've certainly got some planning around how we scale up our current response. We know that it's been challenging to do that so quickly, but over the weekend we've had a lot of teams working to make sure that we can identify the right workforce, the support that people need in the homes and across the whole of the community. So yes, we do have plans to scale that up. We are stretched at the moment, but that's nonetheless, we'll make it happen. We're all in this together, and I know we've got a lot of people willing to rally and help out.
The contact tracing is in some cases a week or so behind. Why is it taking so long to identify exposure sites, especially, I guess, given we're now seeing them in towns that we don't know if they're being active cases?
Sure. So we're typically getting the contact tracing finished within 24 hours. We've got a big resource from the statewide contact tracing team, and I believe from interstate, that are helping out to make sure those are getting fast-tracked as much as possible. Where we do have locations of concern being identified, sometimes that could take us 24 to 48 hours to make sure that we've got the assessment of that facility and the environment really accurate, so that we're making sure that any close contacts or other contacts that are identified out of those facilities are accurate and we're not causing unnecessary concern. We are fast-tracking a lot of those notifications to be public as quickly as we can. There's a specialist team that's doing the larger facilities like the big Woolworths, Coles, Bunnings and other large facilities that are looking into all of those facilities as quickly as possible. So I know those timeframes have been a little stretched. We will see them get more regular and consistent.
Can you shed any more light on the origin of the outbreak and kind of how it's sort of unfolded?
We're not 100% sure yet on the origins of the first COVID case that came into Western New South Wales. As we know, we had sewage tests going off as a month or 6 weeks ago up in Burke and other locations, and so it's not 100% clear to us. We know some of the early cases we've identified. Our contact tracing teams have done all of their detective work to try and figure out where that is. There's some suspicions, but to be honest, we're in the situation we're in now. Doesn't really matter where it came from originally. We've got a fast growing number of cases, and this is a really crucial time for us. Please everyone stay at home, just stop moving around. If you have any symptoms, please come and get tested as quickly as you can.
Good one. Thanks, guys.
Thanks everyone.
Thank you.
Oh, sorry, can I just double check the Burke man? Is he